HPV is a very common sexually transmitted virus that probably at least 80% of women have been exposed to at some point in their life once they have become sexually active. So this is an important virus for us to screen for, and some of the recommendations can be a little bit confusing to patients. However, we do it based on your age. And for women who are 21 to 30 years old, the only reason they would be screened for the HPV virus would be if their pap smear returned as a low-grade abnormality. The reason we don't screen for high-grade abnormalities is because we presume the virus is there. The good news for these young women is that the HPV virus will often resolve itself over a period of 1 to 3 years. So it's not something that they will permanently have in their system, and often the abnormal cells that go along with that can also be resolved over time. When women reach the age of 30, we do a screen for HPV regardless of their pap smear. So if they were exposed to HPV potentially in their 20s but never showed any abnormality on their pap smear, and it's still hanging around in their 30s, it's something we may want to watch a little more closely. From 30 until 65, we'll screen women with a pap and an HPV every 3 to 5 years if it's negative. And if it's positive, then they potentially will have an additional procedure to evaluate the cervix a little more closely.